Hi, this is Eskimo TV with our guest today, Dr. Michael Wall, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine of Mount Kisco, PC. Today we're going to be talking about weight loss and keeping it off. Doctor, aside from one's metabolism, what other factors can influence a person's ability to lose weight and keep it off?
Well, this is a really important topic, of course, the whole concept of weight loss and keeping it off. So the most important thing probably that determines weight is one's genetics. But genetics is just one factor. If a person knows that they have difficulty losing weight, then they might suspect that their genetics are a bit limited. But if one looks at lifestyle, looks at exercise, looks at diet and other lifestyle habits, lifestyle can be adjusted relative to one's genetics. So I've never had a patient that cannot lose weight once they became clear about what their genetic limitations might be and just worked around them. So genetics is one very important factor. The other is obviously how one eats. Sometimes a person may have a health problem that negatively affects how they would lose or keep weight off. So the solution to their weight loss would be to find out what those health issues are and manage them. And then therefore they would lose weight as a side effect of gaining health. Those are a few examples of the determinants of how one loses weight and how one could keep it off effectively over time.
And what is the best way to lose weight?
Well, the best way really is, there is no best way. That does depend on the person. But weight loss efforts always must include regular habits and setting good examples. So whether we're talking about children or adults in terms of weight loss, we want to set up the structure of our lives for success. We don't want to have unhealthy food in the house, refined and processed carbohydrates, for example. So one of the ways of successfully losing weight is to be aware of what healthy foods are and choose them. Eat organically when possible, chewing foods well, eating very low down on the food chain, meaning lots of fruits, vegetables, nuts, seeds, and grains, very little animal products, exercising on a regular basis, getting plenty of sleep, taking care of oneself on a regular basis. So habits that are set up and done on a regular basis are the most surefire way to lose weight and keep it off over time.
Is it dangerous or unhealthy for a person of adequate weight to keep trying to lose more?
Well, if a person has adequate weight, they might have some other health goal or athletic goal in terms of weight loss. But generally, yes, by definition, if someone's at adequate weight, well, let's define what that means. There are weight height charts that are set up by generally insurance companies which determine what adequate weight should be. But then there is what is adequate weight for reduction of disease risk and for longevity. So there's two different types of scales. I use the longevity scales when I determine whether or not someone might be of normal weight based on these standardized scales of what they should weigh, as opposed to what they actually should weigh in terms of their body composition. So the quick answer is this. The best way to be is whatever weight is consistent with a favorable body composition. A body composition can be determined based on what's called bioimpedance testing, which lets a person know what their metabolic rate is and what their protein, carbohydrate, and fat intake should be, and more importantly, what the percentage of muscle, water, and fat is in the body. So once you know what the ideal balance of muscle, water, and fat is in the body, there'll be a certain weight that person has, and that is the correct weight for them for health and longevity purposes.
And what nutritional habits should a person adopt in order to keep off the weight they've lost?
Well, one of the things that a person should be mindful of is, again, as I mentioned, eating organically when possible, when you can, to have a diet that is mostly consistent of fruits, vegetables, nuts, seeds, and grains. And then the nuts should be raw, because when you roast nuts, they're saturated, and saturated fat promotes weight gain. To eat lots of healthy fats in the diet. Those are the mono and the polyunsaturated fats, keeping the trans fats and the saturated fats down. A person would want to have fewer very highly cooked and overly processed foods, again, like red meats or refined and processed carbohydrates, white flours, those sorts of things. Some people, if they're allergic to certain foods, that might promote weight gain, so a person might need to be mindful of that. And certainly eating foods that are consistent with with what their health needs actually are. So if a person is diabetic, for example, and they're overweight, then they need to have foods that are low on what's known as the glycemic index, which means foods that don't cause such abrupt blood sugar problems. But that's probably good for just about anyone. But in general, I like to tell my patients to think like a vegetarian or a vegan. You don't have to be a vegan or a vegetarian all the way, but if you adopt those types of health lifestyle factors, weight is almost never a problem.
This has been Ask Camilla TV with our guest, Dr. Michael Wall, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine of Mount Kisco, PC. Thank you, Doctor.
Thank you.